All right, we're here today at Advanced Dentistry of Philadelphia, and I'm with Michelle. Michelle is a patient of Dr. Batra's, and she is a patient who went through the LANAP process to address some issues with periodontal disease with a great outcome. So we want to talk to Michelle and just find out. So talk to me about some of the challenges you've had with maintaining oral health over the years, and when did you first learn about gum disease and that you might be affected by it?
Well, I've always done throughout the years my normal, annual 2 or 3 times cleanings a year. Started back at an early age. My teeth started rotting in the gums, but on the surface they were fine. But back then, the doctor said, I didn't have any gum disease or anything that happens sometimes or whatever. But fast forward into adulthood and old age.
Not old, you're beautiful.
I started to, still continue with my regimen of, checking on my teeth. I've had some deep cleanings, but in the last year and a half, I started experiencing some uncomfortableness in the gum area, and the dentist, indicated that, I could have, some gum disease going on. And in the last year, I actually met Dr. Batra in my dental office. She was a newcomer to that practice, and she handled me as a patient there and introduced me to the LANAP program.
Okay.
And explained that, now that I'm getting older, my bone structure was getting weak and something needed to be done as in to keep me from losing my teeth.
So how was it going through the LANAP surgical process? And, how did you feel going through it? And describe what it feels like now that you're on the other side of it, and how Dr. Batra worked with you through that.
Okay. Well, first of all, let me say Dr. Batra is excellent. She made the whole process very easy to get through, and I was frightened to death just because I'm frightened of dentists anyway, regardless of who it is. So I went in very nervous, even though she explained the entire process to me, how it would work. She did, it's a long process, and she did half of my mouth one day, and then I came back a few weeks later and got the other side completed. Going into the process, I was very nervous, of course, because I wasn't sure what I was going to experience, even though she told me what I was going to experience. So being very nervous, I was very tense. I really didn't feel anything once the numbing process, was completed. I wasn't, I didn't have to be put to sleep, just heavily numbed. And
were you comfortable throughout the process?
Very comfortable.
Excellent.
Comfortable, just still nervous, but not because of anything going on with the process, just me and my nervousness about going through any kind of procedure. But she was continuously, checking on me, making sure I was okay, explaining what she was doing, explaining what I would be experiencing while I was going through it. So she really, really helped the process. And so after going through the first, completing it, she again explained, you may have a little discomfort once the numbness wears off. But I really didn't. I did take some painkillers for the first day, and that was it. I didn't even need the painkillers after the second day on. And I stopped taking them, and I came back and had the other side. So when I had the second half of my mouth completed or done, I was a little less nervous.
Okay.
Felt a little bit more comfortable because I had already been through it. I knew exactly what to expect.
And how do you feel today?
I feel fantastic.
Are you glad you did it?
I am awfully glad because I get to keep my teeth.
Awesome.
and I've had my first checkup since the my first cleaning since the process was completed a few months ago.
And how was that?
Excellent. I got high praises from my hygienist, so
Love that.
I'm excited. And she said, you know, you have greatly, your teeth have greatly improved, your gums. She said, it is unbelievable how you have healed and has made a big difference in your mouth.
Excellent. So would you recommend the practice and LANAP with Dr. Batra to have friends and family members?
Most definitely. I would definitely recommend Dr. Batra for just about anything you need done in your mouth that she can do, just because she's very caring, very sincere about caring.
Excellent.
And that's important. You know, doctors can be very nice and, you know, accommodating, but you get the sense that she really understands you individually and what you're going to go through. And so I would recommend her regardless of whether or not